Hello guys, this is Dr. Chinmay and today we are going to discuss about a very important topic from a human physiological point of view that is called as pain. And perhaps pain is the most common complaint for which a person visits a doctor or a clinician. So without wasting any more time, let's talk. Now pain is broadly defined as an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. Now you can see the pain term includes not only the sensory unpleasant feelings but also emotional experiences. It has got two aspects, sensory aspect and affective or emotional aspect. Similarly, it may be associated with actual tissue damage or potential tissue damage. That means there is not yet any tissue damage, still we start feeling pain. It can be actually potential tissue damage like a pin prick. The pin is not yet pricked but we start feeling pain, so that we can protect ourselves. Similarly, if we feel that there is some painful stimulus which is due to the affective or emotional part, we can start feeling pain. So the pain is a broad term, that's why it is defined in a broader way. But there is another term called as nociception. What is it? It is an unconscious activity induced by a harmful stimulus applied to the sense receptors. So you can see whenever a pin is pricked or before pricking, when a pin touches our hand, we just remove our hand from that painful stimulus. Similarly, when a mosquito starts biting, we unconsciously bring this hand and hit it. So that is an unconscious activity which is induced in a reflex manner, so that a harmful stimulus, we protect ourselves from a harmful stimulus. So that is purely sensory, and that is due to the nociceptors or the pain receptors which are present in our body. Our primary pain receptors are actually in our body are A delta and C fibers. We will discuss about that in detail. Now let us discuss about the types of pain. The pain can be defined in two definitions. One is physiologic pain. The second one is pathologic pain. The physiologic pain is also called as acute pain or good pain. What is that? I have already explained. The tissue is not yet damaged. For example, whenever we will pitch our hand or we will start pricking a pin in our hand, but the pin is not yet pricked. So there is potential tissue damage and there will be initiation of pain, and that is immediate, means that pain will be carried very rapidly to our brain and the brain will immediately respond through our motor activity. As this kind of pain is protective, because we will protect ourselves from potential damage of the tissue, it is called as good pain. As it is short lasting, means the pain will be there and it will be abolished once the potential damaging substance is removed. That's why it is also called as acute pain. Then there is another kind of pain that is called as pathologic or chronic pain, which is also called as bad pain. What is this? When the tissue is actually damaged due to pin prick, due to cut wound, or the mosquito bites. After that, there will be a process of inflammation, or suppose there is damage to the nervous system. Those nerve or the nerve fibers which are actually carrying the sensation, they are damaged. There will be also a kind of pain. So whenever there is an inflammation, either due to an injury or infection or any other cause like autoimmune conditions, and there is pain, it is also called as inflammatory pain, which is a kind of pathological pain. Similarly, whenever there is damage to the nervous system or the nerves, peripheral nerves, it is called as neuropathic pain. Either the nerves are compressed or damaged for any reason, there will be neuropathic pain, and both these kind of pains are different and the management is also different. So you can see the acute pain is a sudden sensation which protects or alerts us from a possible injury. Chronic pain is a persistent kind of pain which may last months or even more than that. Then coming to few definitions. First of all, what is hyperalgesia? Hyperalgesia is an exaggerated response to a noxious stimulus. We have to remember that a noxious stimulus means a painful stimulus is present, but the response is exaggerated. The response that should be present in a normal skin or a normal tissue, now it is exaggerated. It is called as hyperalgesia. The second term is allodynia, the sensation of pain in response to a normally innocuous stimulus. Here, the stimulus is innocuous, like while we will touch our hand, it is a normally innocuous stimulus. Touching up our shirt to our body, touching up the shower water to our face, these are normally innocuous stimulus. These are not noxious stimulus. But at certain situations they are painful. For example, if there is sunburn, or shirt touch can also be painful. So those situations it is called as allodynia. And both these kind of pains are seen in pathological pain. Here in this diagram you can very easily understand, in injury, whenever there is injury, that means in injury there will be pathological pain, and injury of the tissue will cause inflammatory pathological pain. So here what happens, the normal pain threshold is actually reduced and moved backwards. Once the normal pain threshold moves from here to here, what happens? This normal pain response is reduced and a normally innocuous stimulus will also create pain sensation, which is called as allodynia, and mildly noxious stimuli will cause exaggerated pain sensation, which is called as hyperalgesia. Now coming to the term sensitization. What happens? The injured cells start releasing certain chemicals such as potassium, bradykinin, substance P, histamine, serotonin, prostaglandin, etc. And the role of these chemokines is to make the nociceptor more responsive to the painful stimulus. Now, what happens whenever there is injury or damage or pathology, there will be enhanced pain sensation. You can observe clearly that whenever there is a cut wound here, this part of the body will be more sensitive to pain. You will touch this part, it will not be painful, but if you will touch this part, it will be painful, and it will show both allodynia and hyperalgesia. And the reason behind that are two. One is sensitization, second one is wind-up phenomenon. I will be explaining. There are further more reasons, but these are primary reasons. And in sensitization, what happens? As you can see, due to an injury, there is release of local chemokines like bradykinin, 5-HT or serotonin, prostaglandin, potassium, histamine, etc. Similarly, after excitation of this nociceptor, the nearby nociceptors start releasing certain chemokines like CGRP and substance P. And these chemokines can directly act on these nociceptors to stimulate that, or can also indirectly act by enhancing the release of certain chemokines like histamine from mast cells. So after that, they can also enhance the vasodilatation of the local tissue, through which the inflammatory mediators and the inflammatory cells like the polymorphonuclear cells will arrive at that spot, and the inflammatory process is further enhanced, and in a vicious cycle the sensitization process is enhanced, due to which the pain sensation is exaggerated multiple folds. Now similarly, I have already explained there is another term called wind-up phenomenon. Now as the sensitization process is actually occurring at the site of tissue injury or inflammation, this wind-up phenomenon is occurring at a different location. That is the dorsal horn of the spinal cord, where the first order neuron ends. So these nociceptors will carry the painful pain sensation from the tissue, and it will end at the dorsal horn of the spinal cord, and from there the second order neuron originates, which will carry the pain sensation through the spinothalamic tract, mostly the ventrolateral spinothalamic tract, and at the location of dorsal horn of the spinal cord, a phenomenon occurs through which the pain sensation is exaggerated multiple folds, which is called as wind-up phenomenon. Now, before going to detail of this, I must say one thing, that the location, that is the dorsal horn of the spinal cord, more precisely if I will tell, the specific location, which is also called as substantia gelatinosa, which is situated in the dorsal horn of the spinal cord, is a location of very high strategic importance. Why? At that location, the sensation of the pain can be seriously exaggerated or enhanced. It can also be depressed or diminished, or it can be abolished also. So this is such a location where anything can happen, and using multiple methods, the pain sensation can be increased or decreased or abolished. So here this wind up phenomenon is explanation how the pain sensation is increased at the location of dorsal horn of the spinal cord. What is happening? Once there is tissue injury, there is a release of two kind of neurotransmitter at the end of the nerve, because when there is no tissue injury, the A delta fibers will carry the impulse, and A delta fibers will release a neurotransmitter, that is glutamate. But when there is tissue injury, the end of the fiber, that is the C fiber, which carries the injurious stimulus or the chronic pain type of impulse, will release two kind of neurotransmitters, both are substance P and glutamate. And the combination of these neurotransmitter will cause excessive activation of the NMDA receptor at the postsynaptic plate. Due to excessive activation of this NMDA receptor at the postsynaptic plate, there is exaggeration of the painful stimulus carriage, and due to which there is enhancement of the pain sensation, and these two mechanisms explain the exaggeration of the pain sensation due to any injury. Now in this diagram you can see the diagram in the left explains the dorsal column. We are not concerned about that in this video. Here the diagram in the right explains the path of the pain sensation. It is carried from the peripheral tissue in upper limb and in lower limb through the nociceptors. The nociceptors will end in the dorsal horn of the spinal cord. From there the second order neurons are originating, and they are decussating to the opposite side to be carried upwards through the ventrolateral spinothalamic tract. This is the ventrolateral spinothalamic tract. This second order neuron ends at the ventral posterolateral nucleus of the brain, and from there the third order neurons are originating, and that third order neuron will supply to the higher center of the brain, primarily to the somatosensory cortex and to the limbic system. Somatosensory cortex is responsible for the sensory part of the impulse, and the limbic system is primarily responsible for the affective or emotional part of this pain sensation.